Join us this new year for new conversations at the Commonwealth Club.
Welcome, everyone. Welcome to the Michelle Meow Show at the Commonwealth Club of California. Thanks for joining us today, for those of you here in the auditorium, as well as everyone watching or listening online. For any of you who are joining us for the first time, the Commonwealth Club is a 118, I think we might be 119-year-old, nonpartisan, nonprofit organization dedicated to the civil discussion of important issues and hopefully help the community in the process. The Commonwealth Club produces hundreds of programs a year, even during the pandemic. You can find our future upcoming programs, as well as audio and video of past events at commonwealthclub.org. And you can find specific Michelle Meow Show programs at commonwealthclub.org/MMS. So first of all, housekeeping. If you're in the auditorium here, please silence your phone, since we are, of course, streaming this live, as well as recording it for the future. If you're at home, you can let your phone ring as loud as you want. It doesn't matter. We want to thank Gilead Sciences for its support of the Michelle Meow Show at the Commonwealth Club. And we're glad tonight to be partnering with TransClinique on this special event series. TransClinique is the first national trans-owned and operated gender-affirming telehealth clinic. And last but not least, thanks to SF AIDS Foundation for the post-program food and entertainment you'll be able to enjoy up on the rooftop when we're done down here. Now, it's my pleasure to introduce Michelle Meow. She is the producer and host of The Michelle Meow Show and a member of the Commonwealth Club Board of Governors, and she's sitting right next to me. Hi.
Thank you so much, John, for that awesome introduction, and welcome all of you to this program. Thanks for taking out some time this Friday evening, and I know it's still something that we're getting used to, coming out in person, and then for those of you who are joining online, keep doing you. Keep doing the new normal. The Michelle Meow Show, for those who are joining us for the very first time, is your A through Z covering the LGBT, LMNOP, and everyone in between. I'm very pleased to introduce to you our esteemed panel here who will all talk about the future and transgender healthcare, or I should say, in a much more inclusive way, trans, gender nonconforming, our non-binary communities, and how by focusing on our community, we can create a much more inclusive world for healthcare. So let me begin by introducing you to Dr. Heidi Wittenberg, who's sitting right here next to me. She is a medical director at the Gender Institute and chief of surgery at St. Francis Memorial Hospital, and also director of Mosaic Care, Inc. Next, we have Dr. Christy Butler, who's assistant professor and urologic surgeon at the University of California at San Francisco. Dr. Ellie Zara Lay, who is a plastic surgeon physician at the Gender Confirmation Center. And last but not least, Dr. Alexis Petra, who's the founder and CEO of TransClinique. Let's welcome everyone to the program. So why don't we have you all start by sharing how and why you joined the medical field and what inspired you to specialize in trans-affirming healthcare. What changes have you experienced in trans healthcare over the last decade? Dr. Wittenberg?
So I was originally an OBGYN by training, and I've been practicing in San Francisco since 1999, and started off as a pelvic reconstructive surgeon and became more specialized with minimally invasive GYN surgery and techniques, neurourology, pelvic pain, robotic surgery. And then I was asked by a gender affirmation practice to help them with surgeries. And I trained with them for a year and realized that this is kind of the pinnacle of reconstructive surgery and is complicated enough that it really needs to be focused on for patient safety outcomes and to really progress the surgery along. So decided to focus. I felt I was professionally, evolutionarily made for performing these surgeries, and now I'm bringing new babies into the world as I originally had, but as they should have been born.
Dr. Butler.
I think for me, it was certainly kind of an evolution. You know, I went into medicine like a lot of folks. I was drawn to more particularly vulnerable populations. I worked a lot with homeless. I worked a lot with the underinsured, and really had a particular focus for more vulnerable populations. And it wasn't until I got to my training in urology where I was exposed for the first time to gender diverse individuals, and really just kind of seeing how they were treated, the mistreatment, people not even wanting to come down and see or examine them because they didn't know what to do. I just found that really baffling, and I really kind of took it upon myself in my research gap year, where I learned and educated myself with and shadowed some other folks, kind of better understanding their plights and what they go through to get to surgery, and just in the field of medicine, and learned that I could have a focus on this. So I actually did a year of fellowship up at Oregon Health and Science University, where I specialized in gender affirming surgery and urologic reconstruction, just kind of honing in on specific skills to be able to offer gender affirmation surgery, and then really wanting to bring that back to UCSF, where it was so sorely missed. And that's what I'm hoping to do now going forward.
Dr. Lee?
So my path to gender surgery, I kind of think of it as sort of a series of unfortunate events that, in retrospect, turned out to be, true blessings. And so I am a plastic surgeon, and so finishing general surgery and wanting to be a plastic surgeon, I took a bit of a long path to become what I am now professionally. And so I did plastic surgery, then went on to do craniofacial and pediatric plastic surgery. Then that just wasn't enough for me, so I just had to keep going. And so then I completed hand and microsurgery training, and went on to become a pretty well-rounded a plastic and reconstructive surgeon doing academic medicine. That's how I started in the field. And I decided to move from the academic setting into the private practice setting. And through, kind of going through that, I was starting to experience, now it's no secret, I am part of the community. And so this was kind of a dark time for me, where I had to decide, whether I should become who I really am or give up and, sort of end it all. So I somehow found the courage or strength to accept myself and then move on. And so sort of by serendipity, I myself was looking for surgery, and when I went to see one of the sort of old giants in gender surgery, Dr. Toby Meltzer, he was my surgeon. I went in, literally looking for surgery, and came out with a job. So he offered me, he really did, my very, very first consult. We got to talking, he asked me what I did, and he was pretty impressed with my background. And just, just like Dr. Wittenberg said, through the experiences and the fellowships, it seemed like I had the right set of skills. And sometimes it just takes someone to really sort of believe in you, take you under their wing. And that's what Dr. Meltzer did. I'm forever grateful for him, even though I'm not in his group anymore. But he trained me, and because he is one of these sort of old, well-established practices where back in the day he did everything because that's what he had to do. Learn it all and then do it all. He passed it all on to me, and I was able to sort of continue that work, and I still do today. I offer fully comprehensive surgery across the, essentially the entire gender spectrum, and that has made me who I am, and it's been very fulfilling, especially in my personal position, to be able to provide that.
Thank you so much.
Yeah.
And Dr. Alexis?
Oh, sure. I think I went to college. I was the first person in my family, first generation college. So it was really important for me to collect as many degrees as possible. So I think that's why I went to med school. But for real, it was always a combination of math, science, and helping people as far as med school. As far as trans affirming care, non-binary folks. I've been personally or professionally involved in the community for over 20 years. I don't want to date myself, but whether it be sort of a baby trans hanging out at the Abbey in West Hollywood, or divas, or something like that. I've really been with the community for quite a long time, so I have very intimate knowledge and connection. And I've always wanted to, find my space to kind of give back, and I finally found it, a couple of years ago, and we could talk more about that in a little bit. But so yeah, it's just, it's kind of my lane, my way of giving back, and I'm really happy to work with the community. So that's basically how it started.
Well, thanks for sharing how you each got into it. I'd like to hear from each of you, maybe like or during the past 10 years or whatever, what are a couple of the most important developments you've seen or changes you've seen in trans-affirming healthcare, say for the past decade? And why don't we start with you and go backwards?
Yeah, absolutely. So for one thing, compared to when I transitioned, which is 15, 20 years ago, there wasn't quite as much publicity about trans care. There wasn't. You had to kind of search it out, and it wasn't quite as easy. So something like Trans Clinique, where it's super accessible. So there's been all positive changes, and I think that trans care in general, trans health, people are paying more attention to it, and it's become a lot more important part of the landscape in healthcare, medical school training. Have these amazing surgeons and advancements in the care that that you can provide for people to transition. So I think accessibility has definitely improved markedly in the past decade, and just awareness.
Great.
I agree with Dr. Alexis. Some of the advances or progress in healthcare in the time that I've been doing gender surgery is really just more insurance carriers offering coverage for gender-related, certainly surgical care, and not just focusing on what a lot of people tend to focus is what's between your legs type of thing. They are expanding those services and coverage in terms of the insurance carriers to things like facial feminization, facial masculinization, body contouring, breast augmentation, which the majority of the society, think of it as cosmetic surgeries. Well, they really aren't. They are medically necessary procedures to treat our patients, treat their health, but also, it all goes towards their safety too in the public space.
I would say representation. I think, there's definitely more of a push to have more gender diverse individuals represented in the field of medicine, not only as patients, but as providers, especially even like within schools. And I think that's important, especially when we talk about, when we're gathering as an academic centers and having these conversations and standardizing how we go about doing surgeries, recognizing that there's differences, but making sure as a safety standpoint, we're kind of protocolizing things and being able to talk about them more openly in academic forums and have more educated conversations about it.
Great.
Agree with everything. I would say there's also just, if you see over the last 10 years, how membership to the World Professional Association of Transgender Health has increased in its numbers, and how beginning with certain departments or organizations actually want to hear and be educated as to for patients would have to cobble together their care and educate their providers is the beginning of people being aware there's gender care, and also there's care that irrespective of someone's gender, you take care of them. So just opening up the doors. And so it's becoming more, society's becoming more aware, and instead of a patient across the country calling their surgeon, and at least there's starting to be local providers, which is a big thing over the last 10 years, which is great.
It's all
signs pointing upwards and positive and good news. This is great.
I think so. Definitely.
Dr. Alexis, why don't we talk about why you started Trans Clinique and how creating space in this way might be changing the landscape for trans affirming care, and basically how talk to us about the access this creates for the trans and non-binary communities.
Yeah, for sure. So I kind of thought about it. Well, I've always wanted to, again, give back and create a space and sort of a clinic for the community. And I was thinking how to do it, like local brick and mortar, you get very limited outreach and, it's kind of expensive. And so I kind of was thinking how do I piece this together? This is like late 2019. And then the pandemic started, so it was kind of in a way, it was like a perfect storm or a confluence of events that created this opportunity. So, I was thinking, who wants to order, a doctor on the internet and things like that? But then everyone's on Zoom now, so everybody's, it became very widely accepted. So all of a sudden, just went boom. Everyone's shelter in place. The clinics are closed. It's very limited access during that period of time, especially. So, since then, I've got relationships with labs to make it very affordable, compound pharmacies, you can have shipped to your house if you want, things like that. So the accessibility, I'm in 26 states right now, so, if you're at any of the border of those, within that state, you don't have to drive 2 or 3 hours or wait 6 months to get an appointment. So it's, it's as easy as picking up your phone or your laptop and, scheduling a Zoom call. So, accessibility, that's basically it. Safety, if you're marginalized, you don't have to go out. I took care of someone in Alabama yesterday who, was kind of afraid to, come out right away. And so I think the safety, accessibility, convenience, all those things, has made it, wonderful for people. So I'm excited about the continuation of this.
Dr. Lay, when in the field of trans healthcare, mostly you're going to find cis male practitioners, I think, or at least traditionally have. You've got deep roots in this community, obviously, and talk a bit more about both what you bring to it as well as what you and others can do to attract more trans people into the healthcare practitioner side.
Yeah, sure. And there's nothing wrong with cis males providing gender care. But yes, you're right. There are many, it's pretty rare to have a trans surgical provider. I'm sort of unique in that way, but hopefully not for long. But in terms of what it can give, I think we are, certainly the major centers, we're all very competent in providing care, and we provide compassionate care and really wish our patients well. But the only thing I can say that I sort of bring extra is the fact that I've been through it. And, as painful as it is to sort of keep bringing up like those parts that I just want to squash down, I realize that, I can really help a patient in a much different level by sharing even my own experiences, as uncomfortable as those are. And sometimes it gets to me and I'm just like, why? Just shut up, don't say anything. But honestly, if it helps a patient get through dilation or it helps them get through a certain complication, I tell them, look, it's surgery, what you're going through is yes, it sucks, but it's not that bad. So I bring that extra, I guess, tenderness, maybe, TLC, to my patients, and they, for the most part, they seem to appreciate it. For the most part, sometimes they get mad at me even for that. But yeah, I think that's a part. But that it's not a requirement to obviously be a good provider, because I'm surrounded by them here. But some people, I want them to come to me because I'm good, not because I'm trans or things like that. But it does help a little bit, and some people do. And I do appreciate that, because it just means that I'm doing a good job at what I'm doing, but I'm also serving perhaps for the youth or for other people, becoming a positive role model in the community and showing that, with, persistence, encouragement, and even through failures that you can still basically make it. I think at the medical school level or at the undergrad level for all the youth, for anyone, not just someone like me, is just to be supportive and instill basically courage and resilience. Those characteristics to our youth to say that, look, don't let this hold you back. Use this and move forward, and you can reach high. You don't have to settle for anything less than that. And so I have had patients who are medical students, and they want to be, they want to go into gender surgery, and they're so smart that I have no doubt that they will. So I actually look forward to having more people within our community, not just trans, but gender diverse, sort of rise through the ranks of medicine anyway, but any field really, and just get out there and show the world really that we are capable, we're here, and we're good people, because there's so much hate. Just like Dr. Petra said, she mentioned Alabama, and I think she mentioned it for a reason. Because I woke up this morning to my nerdy, wake-up call of, NPR news flash, and the first story, which really woke me up, was, what happened in Alabama and how I could literally go to jail there for doing what I do. So it's upsetting.
You mentioned some of your patients and their interest in the field of medicine. Have you ever offered any of them a job in their first appointment?
Oh, not yet. Not yet, but I might just return the favor.
Pay it forward, yeah. Mm-hmm. Michelle?
Yeah. Dr. Butler, you're both a medical professional and a professor in the educational field. And so what advancements have you seen in the field, but also what additional education do you think we need?
That's a great question. I think a lot of what we've already kind of discussed so far today, I think just recognizing the mistreatment and discrimination that's occurred thus far and how, we can really make a difference. And I think kind of adopting two things. One, this collaborative approach, right? We are opening to more forums. We're opening to more lectures, fellowships for dedicated study of this. I think that's a huge advancement in this field that wasn't there before. Similarly, I think this idea of a multidisciplinary model, right, where you can collaborate with people from different specialties, from medicine, from mental health services, from social services. These are all fields that are really needed to treat the individual, right? It takes a village to treat the individual. So being able to adopt that sort of model where you can have these sort of discussions and figure out what's the best approach to treat each patient, because it's all different. As far as, what education is needed, I mean, there's so much, but I think, when we think about it, we're fortunate to be in the Bay Area, right, where we have a lot of gender affirming providers at our fingertips, but in other places like Alabama, where there's really maybe one provider. And what it comes down to is we're really aiming for this gender affirming society that goes from a gender affirming individual, a gender affirming hospital or team, and then a hospital and then a society. That's really what we're aiming for. And I think a lot of that stems from just more education. Even, within these more progressive institutions, there's still a lot of education that needs to be done of how do we provide a more affirming environment, use more inclusive language, more visibility, trans visibility just on the walls, gender neutral bathrooms, adopting and evolving with the change of language. Even, when you read some certain papers, so they're still using terminology that's outdated. And recognizing our own biases and what we bring to the table and how we can recognize that in order to make those changes when we're interfacing with a patient. So there's a lot, I think, that we still need to move towards. But.
Dr. Wittenberg, a similar question for you. I mean, you've been a leader in this area for a long time. So what are some of the changes you've seen, and then what are some of the changes you think are still needed, and where specifically?
How much time do we have? Well, I mean, first of all, one of the biggest changes is insurance starting to get coverage. And we're lucky we're in California, which requires insurances to cover that. But sometimes insurance companies do workarounds for that. So one is the access to care has gotten better. I think California is leading by having that access. And because of that, we have a higher volume. We've got probably one of the highest number of gender specialized providers. And for instance, even having centers has been an evolution. The Gender Institute at St. Francis was founded 6 years ago at this point, and is working towards, as we all should be, as the fellowships have started, more training, global education, and WPATH has a Global Education Institute to help with that. But these centers that help provide wraparound services or work with wonderful niche programs that are already in the community, like Lyon Martin or the Community Health Center or the San Francisco Department of Public Health, and how we can integrate together, which is why I think San Francisco's a little bit of a different animal, but we're taking advantage of all these wonderful programs. Where we need to go is having standardization and standardized training. I'm really proud of this, but St. Francis became the first hospital to be a center of excellence for gender affirmation surgery based on the Surgical Review Corporation, which is a nonprofit for safety and patient outcomes. So starting with those programs, accredited fellowships, and one of the other big things is San Francisco has been great with the underprivileged, underserved. A lot of our higher functioning patients have had to navigate themselves. So we do need centers with more navigation. We need legal advocacy, financial advocacy, like those things going forward. And the other big thing is, particularly I'm narrowing it down to surgery, is people think, oh, they just come in for surgery and boop, 2 weeks later you're gone. There's a lot of recovery and support, safe spaces that are needed, 3 months off for our particular surgery off of work. Support, they're in the Bay Area for a month. A support person is with them for a minimum of 2 weeks. Those are huge financial, logistical issues. Put COVID on top of that. But we really need a lot more support service to have successful outcomes. People trying to cram in one of the biggest surgeries in their life and try to go back 2 weeks later are setting themselves up for failure. So there's just needs to be education, support, so that people can move on with their lives, and someone like me is just a blip on their radar.
Needing education and support to deal with the emotional and mental and relationship aspects of the change, or
that too. I mean, just socioeconomic, mentally, physically. There's so much that goes into counseling. We're like, okay, we want you, if you're not from the area, we want you to have a local provider when you go home. So they don't have to be specialized in the surgery. I just need to be talking to somebody medical. I want you to prophylactically make an appointment with a mental health provider about 8 to 10 weeks out. You're going to hit a post-op blues phase, which any big surgery you have, you're going to have post-op blues. But that compounding on everything, we just need all these things set up to set someone up for success, so they don't spiral or stop taking care of themselves, or don't go in and unfortunately go into a place that is not set up for them and get not the appropriate care, which can lead to complications.
Mm-hmm. I think everyone here on this panel, you probably have a thing or two to say in terms of the barriers that the TGNC community faces when it comes to access to care. if we could have you also add your thoughts to it, and maybe even specifically how your organization or your center is addressing some of these barriers, such as costs, such as healthcare, and the general access. Dr. Why did I just blank on your name?
Oh, Wittenberg. I know, it's no problem.
Dr. Wittenberg just talked a whole lot about how San Francisco is leading when it comes to some of these issues. But then Dr. Lay had also mentioned, Dr. Alexis had talked about a state like Alabama, where 90% of these barriers exist. So if you could add your thoughts also to how we address, how we tackle some of these barriers. I'll start with Dr. Alexis.
Yeah, sure. So I think, my organization, TransClinique, is definitely, addressing, breaking down the barriers in terms of accessibility. Granted, it's not a free service, but literally my goal is to expand to all 50 states and to expand patient load and volume through foundations and grants rather than venture capital, which some of the other people have done. So that's my goal. So, the person, I offer as much free care as I can, but there's, time constraints and things like that, cost constraints, licensing, insurance, et cetera. So there's definitely, some barriers in terms of that. But in terms of accessibility, it's definitely there right now in the 26 states that I'm offering. You have to look out. Florida, Texas, Arizona, Alabama. Some of these places are, starting to obviously pass stringent rules that providers can get fined and/or jail time for providing care. So far, that's just limited to minors, but I wouldn't be surprised if they start going after. Attacking things like telemedicine or other type of surgical providers. So it's definitely something to be aware of. But like I said, accessibility-wise, I think that we've come a long way, whether it be the telemedicine, TransClinique versus other foundations in a lot of major cities. New York, San Francisco in particular is, the best for sure.
Dr. Lay?
I agree with Alexis. I was going to say if I was going first is accessibility. The Zoom, especially with COVID having, hit the whole world and everybody, went to Zoom. We started looking at sort of widening our services and outreach by providing that access so someone could, from Alabama seek a consultation. I certainly don't plan on opening an office there or anything. That's certainly doomed. But there's no law that says that you can't leave the state and have your care done. But we also have to facilitate that. And Dr. Wittenberg sort of touched on that. We have a lot of patients, and probably in each and every one of our practices that come from out of state because they don't have adequate care there. But we need to facilitate that pathway, which is what the Gender Institute is trying to not just establish and provide, but also to set an example to the rest of the country, even the world, on how to provide that high quality type of access to gender care. But that's really the outreach, and aside from that, education. A lot of us do go around and give talks, in different parts of the country. I certainly have, since I started my career in gender surgery, and just through education, I think that also helps not just the patients, but also allies and supporters, and it kind of builds from there.
Dr. Butler?
Yeah, I think all of these are intertwined with each other. I think, for me, it comes down to increasing access for pre-surgical services. I think we talked a lot about, there's a lot that goes into for someone to get surgery. You talk about letters of support, access to mental health, hair removal. And, I think as surgeons, we try workarounds for people who don't have access because of, they're prohibited due to cost, or they don't have a provider who is willing to provide hair removal in the genital region. It's a big barrier for a lot of folks, and we tried workarounds, but really it's about what's optimal for the patient and what's going to work best for long-term outcomes for the patient. So I think trying to increase services, and ultimately it comes down to more providers and insurance coverage.
I'm going to say ditto. There's the big policy. Insurance coverage is number one. And there's more providers now, increasing accessibility, education. So if a patient goes to the ER, an ER physician isn't calling their surgeon who did their gender surgery because they came in with gallbladder symptoms. Like, treat the patient for their gallbladder issues. So just making sure that there's global education on a more pared down individual level is navigators for our higher functioning patients. And we just got a navigator at the Gender Institute. But really programs in San Francisco, like the Department of Public Health, have their own navigators. Lyon Martin has outreach and mobile mobiles that go out to help with our homeless patients and try to set up a housing, actually, and also the community health center. All three of those try to set up a safe space for a homeless patient to stay in their recovery and send out home health care nurses. Providers, and it's a little frustrating when patients get frustrated with us that we're not covered under an insurance, like it's our fault. I was like, no, we asked to be contract. We've worked really hard to so that patients this is not out of pocket. It's covered by insurance. And insurances kind of work around by just not contracting with providers who provide these services. So then for those patients that are not covered and not eligible for programs, there's payment plans, there's working in a surgery center if they're appropriate for it, because surgery centers are far less expensive than hospitals. And trying workarounds in that fashion.
Just quickly, so do you think that the insurance companies need a whole lot of education? Or?
Yeah. In fact, when we were starting, this was now 8 years ago, I was starting my practice and trying to educate why they should contract with me. I had to educate them what I do. It's not removing an ovary. It's not. It's different. It required specialized training, and a lot of the providers who are gender specialized provide a lot of kind of concierge specialized services other than their primary role, because patients don't have access to the wraparounds, and saving it for the original arguments I got is, well, I want to save, we only want to contract with academic centers. Right now, this was 8 years ago, it's only private surgeons who are doing this, and academic centers are not. So, working through that education. So yeah, there was a lot of education and talking to directors, and I'm still doing it. I never signed up for it, but that's part of the job now.
Anybody want to add anything about working with insurance companies? We'll talk. I think that's another show.
Go ahead,
John.
Well, let's talk a bit more about research in particular, new treatments and medicines. Where are some areas of research that you think we need or we should be going, or that you even know that's making good progress and you think will be kind of coming to fruition in the next however many years? Let's start with you, Dr. Wittenberg, and head back down the line.
All right. Well, Global Education Initiative is the high level. In my world, it's how do I make my procedure better? And we're doing a study on it, and we have a couple research studies on studies in our institute, as well as yesterday I did a journal club, and someone brought up more updated terminology and how surgeons might be a little bit more behind the rest, and maybe they could provide education to the surgeons. I said, well, come to our next meeting, and just continued education on, it's across the board at this point.
Dr. Baker?
Yeah, this is a wholly understudied field, and there's so much to dive into, from outcomes research to quality improvement. And I think there's an opportunity here to really be able to hone in on the community aspect of things, right? What's important to the community? What do they want? What research do they want to see being done in terms of how do we better this field? How do we further along, why patients seek surgery, what's important for patients to seek surgery. So I think there's an opportunity to really kind of hone in on that and get them involved in research.
Dr. Lay?
Well, I think we can all agree that in the last 10 years, there's been a great increase in the youth coming out. And so because it seems like it's relatively early in the youth treatment, that a lot of research still has to be even put out. I know that many centers are collecting the data, but it's simply just not long enough to see what the actual long-term effects or studies will really show. So I think sort of keeping track of our youth is a big field that still needs a lot of work on, and it, like I said, it is being worked on. On the other end, I think that a lot of this sort of research doesn't necessarily have to come from big academic centers. Even as individual private practice practitioners, we can still put out data, especially clinical outcome data, and sort of I resonate with my colleagues here of how can we do this better? Is this way of doing it really truly showing the results and the decrease in complications that we really want, but really look at even our own results objectively? And so I actually feel like I kind of missed an opportunity in my last practice. I had so many patients because it was such a large center, but I sort of got busy into obviously learning the techniques, becoming good at it, and sort of left that. But now that I've moved from that practice, I'm actually going to start that now and at least do my little part in collecting my own data and outcomes, and hopefully in the next few years reporting it and being true, obviously, to the data and the science. Even if the numbers don't look that great, I think they will. But putting that out, but on looking into the future, and I do have patients that do ask me about advances, and like the dream, right? The dream of our patients is tissue engineering or tissue transplantation. And so I do get asked a lot about, can I get a penile transplant? Can I get a uterine transplant? And some of these things have been achieved. It's not so much a surgical technical issue. I mean, I can certainly transplant, something like a penis kind of thing, but it's the immunology and the science behind immunology and immunosuppression. So it's a distant dream that unfortunately I don't think it's going to happen in my lifetime. And certainly tissue engineering of, okay, let's make a vagina and then just transfer it and implant it into someone and have it all work. Who knows? I mean, who knows? Even to this day, sometimes I'm amazed that what we do even works.
I was going to say, dream big. Yeah, we can happen. We can make it happen.
So yeah, maybe someday when I'm I'm old already, but really old, I'll be like, wow, I really didn't think I would see this, and I would just be happy.
Dr. Alexis?
Absolutely. So, first of all, wow, those things are amazing, surgical technology and advancement. But from my point of view, I'm sometimes amazed by the number of patients that come to me because they can't find a primary care doctor or theirs aren't willing to prescribe hormones. So it's good for business, but it's like, come on, it's not. So I think a lot of education is needed still, especially in areas that are, more rural and whatnot. So the other thing is interesting is, we're still using medications that are quite a bit older. So like spironolactone, T blocker, that medicine's been around, for decades. And it's like, come on, Gilead, if you're listening, come to me. Honestly,
They're listening, so it's good.
exactly. So let's do a study. Let's get one medicine that, it's a hormone, it's an estrogen, T blocker in one, right? They do all these crazy blood pressure medicines. Why can't they do that? So I think that's, also, kind of a next step because, again, we're still using these ancient medications for things. So I think that's also important as well as the surgical technologies.
We'll start with Dr. Wittenberg, and then it's an open question to the rest of the panel. But I love this question because it's at the heart of our conversation today, which I opened up with, by focusing on or treating patients with a non-binary or gender-neutral or even a trans perspective or lens, that we could create a much more inclusive, healthcare future, meaning that we're not excluding folks, or we're not treating. Okay, let me back up really quick. I don't see trans-affirming care or trans-specific care as just for the transgender community. I think that the rest of the world can benefit when we start looking or having the perspective of care in a non-binary or a TGNC way. Does that make sense to you?
Well, yeah, I think that's, if I'm interpreting right, that we're talking about, because multiple experiences in an emergency room where someone's calling me, and it's about the care of the individual, no matter what surgeries they've had in the past. Am I interpreting that correctly?
Yeah.
And it's like educating people,
for example,
see the person.
yeah, there's
Treat the
exactly.
symptoms. Treat the symptoms.
It's
Don't-
not just a trans person who might come see you for top surgery.
Right.
Right. And then the recovery process is not going to also look like, or at least 100% because you're male and treating you as male or female.
Yeah. We've started at St. Francis Memorial Hospital asking everybody when they walk in the door what's their preferred name and pronouns. And if it's different than what's in the EMR, and we're changing the electronic medical record so it can reflect the desired, but everybody can get a band with their preferred names and pronouns on that. So we're trying to make it more a global acceptance, and all of our badges have our pronouns. We introduce ourselves with our pronouns, and it doesn't matter what this is dietary, and I'm just talking about the hospital, but then we're going to branch out to the offices and in life when we're doing our education. It's like you should introduce yourself as your name and your preferred name and your preferred pronouns, and it just becomes normative, and then it's not a specialty per se or another label.
Yeah, I agree. I think normalizing things, that's the goal, right? You want to provide this sort of affirming approach to all your patients, and shouldn't be that I just have to think about something, especially because it happens to be a trans person walked in front of me. This should be automatic. That's the ideal. Just having this approach and sensitivity to everyone. Everyone comes with their own, even, other cultures, right? There are patients who with different cultures and different ideals that we need to be sensitive to. And I think a lot of times we tend to imprint what we think is best, this kind of paternalistic way of approaching medicine, and we really need to come away from that and empower patients, right? To feel like, okay, let's put them in charge, right? It's their body, there's a long way to go to incorporating that as a group, I think, it's starting with our approach to trans and gender diverse individuals, but there's also a lot to learn and how we can apply that to the rest of our patients.
Anyone else?
That's good.
No, I mean, I agree. It's just awareness, creating awareness that, and kind of getting out of that thinking of the binary thinking. Something is male or female, or masculine or feminine. There's the in between that's a lot larger than anybody really realizes or thinks about. And so I think awareness that there is truly a spectrum, and just being respectful of that person's expression of their gender identity in any setting, really, not just in the healthcare field, but really awareness, I would say, of the in-between.
Yeah, and the last thing I just want to add that there's a lot of intersectionality in terms of, someone's gender diverse, but, come from a multitude of socioeconomic classes, multiple races, language, culture. So like Dr. Butler was referring to, you really have to be aware of all those things and respectful of those things, and, just try to recognize what, that individual patient really needs, and address that and help them through whatever their obstacle is, whether it be, financial, family, there's so many things. Some people have a multitude of support networks, some people have none. So, you really have to just help them navigate. And that's what I feel like my role is, beyond the hormones, is just trying to, help people through the process, maybe not, reinvent the wheel, things that I've went through, mistakes that I made, things like that. So just kind of help them through and get them to the right surgical places, or whatnot. So
the access to information, access to, sound information, and access to medical experts is so important here. But I guess I want to kind of get into the negative, which we've touched on a couple times here, which is these kind of rolling laws, this wave of laws across the country, and they seem to be, sprouting up in more and more, frankly, Republican-controlled legislatures. And Dr. Alexis, you have customers and clients across the country. The rest of you have people who come here for your services. Are you worried for your own practice? Or is this a danger in what you can say, or does that not affect you as long as you're working here? And start with you, Dr. Alexis, because you actually are talking to folks who are in Alabama or Oklahoma or wherever.
Definitely. So definitely have to be, aware of the landscape, which is rapidly changing. It's a shame that, gender diverse and trans non-binary community is the hot button issue, and, the political right, religious right, I should say, political right, are using, our community as, a way to collect votes, and, and so there's backlash against, presidential policies that are just affecting our community because that's the easy target, and historically. And so yeah, it is, in those states in particular, like, right now it's pediatrics, so I need to be very careful about providing for anyone under 18 or 19 even. So, but the next step may be I can't take care of anyone in that state. So, it's definitely out there. Hopefully it doesn't come to that, but again, I feel like, especially with midterm elections coming up, and, our community is always just kind of picked on, for political gain. And, there could be a senator that has a trans kid, but they'll still, be out there pumping these laws just because, because that's how they can collect votes. So,
Dr. Wittenberg.
I would say, it's unfortunate. It's mirroring the reproductive rights as well, and it seems to be the same groups that are trying to create changes in laws and tend to be the same states, and it's again, higher functioning individuals or with better support or socioeconomic can get telehealth or go to other states. But it's really the patients who can't afford to do the workarounds and move to other states or get access to telehealth care that we just need to encourage everybody to vote. Is just one step. But those things kind of mirror each other right now. They're just atrocious laws providing, really legal consequences for people providing the services. Someone who transports a patient for services, a family member who doesn't disclose that someone's having services. It's just unheard of. I mean, it is heard of. It's existing. I'm in disbelief still.
Sure.
Any further thoughts?
I guess I would just say, I'm not fearful for myself. I'm fearful for the community. I'm fearful for my patients because it really comes down to a safety issue. This is, life or death. There's numerous studies that have been done to demonstrate that gender-affirming treatment is life-saving. It decreases mental distress, it decreases suicidal ideation, and just to criminalize and weaponize it, it's only going to make matters worse. We've seen it with abortion rights and people seeking care elsewhere in unsanctioned ways to get the help that they need. It's not going to stop people from seeking help. You're just going to do it in an unhealthy and unsafe way. So that's my fear with this, and I think it's not to say that there's nothing we can do. There is something we can do. We continue to be advocates. We continue to fight the fight and continue to provide the literature, the evidence that we need to demonstrate that why this is so important.
And vote.
Yeah.
And vote.
And vote, yeah.
Please vote. I have one last question, and just a reminder for everyone, we have a social reception upstairs in the beautiful rooftop, and you'll all each get to have access to our panelists or speakers here. So if you've got questions, make sure you come and say hi to all our brilliant speakers. The last question really dovetails around, yes, the negativity, and every year we come up against these horrible fights. Yet at the same time, there are some things that we can celebrate, such as, look how far we've come, right? And so this last question is about the hope for now and the future of trans healthcare. I know we have a lot of work to do. There's a lot of education we got to get out there. The insurance companies got to get their act together. Gilead, it sounds like there's some medicine we've got to update. We need to vote. We have so much work to do, but leave us with some hope and your thoughts on the future of trans care. We'll start with Dr. Wittenberg.
Well, my dream right now in my little realm is really working with all the programs in San Francisco so that we become interconnected. Instead of recreating the wheel and everybody having their own center, is all boats rise. And I use the saying that you said earlier a lot, it takes a village, and we can just be powerful together here and become an example and lead by example. Is where I see this going in the immediate future.
Dr. Butler?
My hope we have these amazing forums where we can have these discussions, and I can be amongst all these amazing women who are doing so much for the field, and to see that it gives me a lot of inspiration and hope, and that we can continue to inspire others, those young, medical students who want to get into gender-affirming care or just even be a representative in the medical field. So I think that we're doing a lot of good, and I think if we can continue to do what we're doing, we can really go far.
I think for me, despite all the negativity surrounding our trans and non-binary youth, my hope is in the youth, actually. It's in the kids. And I think for allies, supporters, even providers, I think finding a way to empower our youth to sort of, as we're sort of saying, fight the fight, do your part. I think that's the most hopeful thing. I see kids frequently in my practice, and I know that they are perhaps going through an even harder time in their transition. And I tell them, I really do. I tell them, you know, you represent hope for me. I mean, I say that personally, honestly. You know, you represent hope for me. You have your whole life ahead of you. And I do remind them that they are very fortunate because they had the ability to have their parents be supportive, to have allies and other supporters get them as far as to our doors, right? Because we're sort of kind of the last line, right? You know, having going through mental health, hormones, and then surgery seems to be like the last thing. I remind them of that, and so that, you know, they can, you know, maybe go home and think about it and be like, wow, you know, she's right. You know, I am the future for our community. And they go on and go to school, seek higher education, you know, become a political figure, that type of thing. And so I remind them how lucky they are that they are where they are, regardless of how hard things seem at that time.
So yeah, I'm very optimistic about the future of trans and non-binary healthcare. You know, I feel we've come, like Michelle said, an enormous way, you know, since I started to try to navigate this journey. And, you know, the accessibility awareness is so much better now than it's ever been. You know, well, I think Gen Z, you know, the great number of those folks are gender diverse or, you know, LGBTQ, race. A lot of those things aren't a big deal anymore. It's a younger generation, the way it's been, you know, for us and Gen X here. And so, yeah, so I think I'm very optimistic about the future in terms of that. And the new technologies of surgery is only, you know, it's amazing.
Are we at Z? Or Z?
Yeah.
That's what I
Beyond
thought.
Z yet?
I think it's double Z's.
Yeah.
Oh, that was, yeah, see, I don't even know.
I want to thank all of our speakers today. Thank you so much for all that you do for our community and your continued service and your passion and commitment to all of our communities, really. So let's give a big round of applause for Dr. Alexis, Dr. Lay, Dr. Butler, and Dr. Wittenberg. John, you want to do the last words?
Thank you,
Reminder?
Michelle, and thank you all of you here in the room, everyone listening and watching online. And again, thanks to Gilead for their steadfast support of the Michelle Meow Show. Thank you for Trans Clinique for partnering with this program series. And thank you for the SF AIDS Foundation for all the wonderful fun we're going to have upstairs in just a couple minutes. Have a wonderful weekend, and let's head up to the rooftop and start our weekend off right.